This is awesome because it's hands-on. So you really get to get in there and you get different views that you would never see in a normal hospital setting. And you get your hands on it and you get to get dirty and look at everything. It's amazing. It's an amazing experience.
Paragon has done a wonderful job in respecting, what these families and patients may have done by donating their bodies to this experience. They've been very respectful, and I think if a family member was here, they would be very pleased with how their loved ones are treated.
It was my first cadaver lab experience, and it was awesome. Being an ER nurse by trade, it's not something that we've actually had time to take time to go over when we've had a patient who we could actually see the anatomy on. Being in smaller facilities, we don't have time to go over those type things. And being in other trauma conferences, we've had pig lungs and things like that, but not to be able to see the depth that we went over today and seeing the cancer that we got to see.
I've always been really interested in studying the anatomy. As a nurse, it's so important that you can visualize the different structures that you're trying to work with, and to actually see it in real life and on a real human and be able to, test the textures of the different tissues and things was just really a great and deep learning experience today.
I've been to multiple and helped put them on before, so it's been a long time, and it's been a great experience getting back in there and watching it again. Even if you've never been to one, you need to go to one. I mean, it should be a requirement if you're in any medical field is to do the lab.
I really enjoyed getting to attempt an intubation. We see that all the time with rapid sequence intubation within our unit for decompensating patients, but to actually get to hold all the tools and feel the ridges and everything like that was just really unique. And I can kind of sympathize now with doctors, especially our younger residents that are training and learning. It's quite difficult.
If you're, someone who's kind of out of the actual hands-on with patients as a director, I think it helps you interact and understand new technology that comes on the fields, the IT clamps and different ways of doing intubations, so that when that's given to you to make that decision to buy, I mean, you've actually hands-on had at least some experience with it and being in the lab.
I can't wait to go tell my students to go to one if they get a chance, because I teach nursing school and I teach all the different levels, and it would really bring to life what we teach in lecture, and it's better than looking at a picture in a book than getting to actually touch it and put your finger on it, and because I can tell you that it's hard all day long or that the liver is soft and smooth, but if you could touch it and feel it, and that the alveoli in the lung are these spongy looking things, but if you could see it and see what they actually do and why that you don't hyperinflate or that why you don't breathe the way you're supposed to or in a cardiac arrest or something, it's really neat.
I definitely learned a lot today in the anatomy and physiology station on correct CPR techniques. So I'll definitely be able to take that back to my facility and say, hey, look, this is why we do it this way. So he was great at explaining exactly how we're supposed to do that and the why behind it.
Just to actually be able to see them that close up and to see the structures in the heart. We talk about, we do bypass surgeries and valve replacement and things like that in my facility. But actually to see those vessels that we're describing that close was really phenomenal. In my time, I've studied textbooks and diagrams galore, but when you see those vessels on the heart or you see the lungs expand, I think it was like an instantaneous learning, something that I will carry with me.
I think the way they present the patients and the people that are donating themselves is in such a respectful manner. It's just not the same as seeing a body that's lying there on an autopsy table.